colleagues and friends who trained with me 20 years ago at Mayo was bragging about how the waiting time for an echocardiogram in Quebec had dropped to 6 months. And I looked at him when he was off the stage and I said, "Are you really proud of that?" He said, "Yeah, we've gotten it down from 8 to 6 months." And I said, "You know good and well you could have it in the next hour in the U.S. And if you're really sick, do you really want to wait 6 months?" Well, we have a way of getting the sicker people in. I said, "How do you do it?" "Well, we work them in after hours." I said, "Okay." So if you had a system kind of like the U.S., a free market system, you could get it all done today and everybody would be happy, right? So we ration in this, everybody rations in healthcare. It's something you don't realize. In the single payer systems, they ration by waiting list and saying you're too old and you can't have this. In this country, we ration by price or by coverage. Which is fairer to you? Which do you prefer? Well, as a consumer, we ration everything. I don't go out and buy Mercedes. I cannot afford them. Some of you may, and I'm glad you do. I don't want to spend that kind of money, okay? It's a personal decision. I would rather make it than have someone else make it for me. Next slide, please. Okay, next slide. All right. And I will just say this. Cost reductions will only occur when we have a functioning marketplace. Next slide. And that has happened once. Look at this thing. What years did the healthcare costs drop to the level of inflation? 94 to 96. What happened in those years? Welfare reform, but something else. What was her name? Hillary. Hillary. She scared everybody. And the healthcare marketplace responded. It can do it. We have not asked the healthcare marketplace to make one sacrifice in this regard. No one has asked me as a physician to lower cost and to do a better job. Fran Bradley will tell you when he was chair of the Health and Human Services Committee in St. Paul, every year people would come and ask for more money for this project or that. I don't think you'll mind me saying this, but I think he waited, 12 years, Fran, or 8 years, for one person to come and say, Representative Bradley, we can do more for less. You never heard that, did you? And he would have jumped up and hugged the person for doing that. But in every other sector of the economy, everybody does more with less. Buy a new computer today, it's far better than the first one I bought in the 80s, and it's cheaper. Think about that. We don't do it with healthcare. Let's go to the next set of slides. I've got to poke a little fun in Washington. Let's keep going. Just so you know, just for your own basis, private insurance covers 63% of people in the U.S., okay? The government covers about 27%. There's a desire for the government to push up to 50%. I don't think we'll get there. We can't afford it, and I'll tell you why in a second. Let's go on to the next slide. Let's keep going on. Let's skip this if we will, okay? This is important. This is the last thing I want to cover that's really important, and I want you to go home with this. I think this is worth talking about. In November, President Obama visited China. And much to everyone's surprise, the Chinese government publicly told the U.S. president to stop health care reform. He says they told him the United States cannot afford health care reform. Why did they say that? They have a lot of our debt, don't they? Let's look at the next few slides. This was a best-selling movie in some people's minds, An Inconvenient Truth by a former vice president. And let's keep going. But there's an inconvenient truth about the current administration, and I want to share that with you now. Let's keep going. One more slide, please. Starting in 2011, the baby boomers began to retire and sign up for Medicare. There will be 78 million of us eventually. I hope I can finish that cohort myself. Right now we have 300 million people in the country. When 78 million are on Medicare, we'll probably have 350 million Americans. That means we'll have 23% of the country being supported by 77%, or 3.34 people supporting every one person on Medicare. Not all of those will be workers. And the worker ratio to Medicare is 2 to 1. When Medicare was designed, the ratio, like in Social Security, was 20 to 1. Okay? Now the next slide. When President Bush signed Medicare reform, Part D, in 2003, there was an estimated, next slide, $41 trillion in unfunded mandates for Medicare, going out 75 years. This is a number issued by David Walker, the Comptroller General of the United States. He was during Bush's term. He's a Democrat, too. Now it's $51 trillion in unfunded mandates for Medicare, going out 75 years. That's a lot of money. What's the U.S. economy? $13 trillion. So right now we're 4 to 5 times the U.S. economy in debt. That would be like you today take your income for this year, multiply by 5, spending that amount of money tonight on your credit card, and hoping to pay it off. That's a big number, isn't it? Okay, let's keep going. So what does this mean? Well, this is what the GAO has said, And I hope some of you running for Congress will use these facts, because I think they scare the heck out of all of us. And I honestly believe anyone in Washington today is running the biggest Ponzi scheme. Bernie Madoff has nothing to be ashamed of. The Congress is running the biggest Ponzi scheme we have with Medicare right now. 2020, 25% of all of our tax revenue will go to pay for Medicare. Okay? In 2030, half, and in 2050, all. Now, when I give this talk overseas, I often say, those of you who worry about aggressive U.S. military operations, don't worry. We won't have a military in 25 years. We can't afford it. I don't envy any of you running for Congress, because when you get there, let's see, we have you running, and who else? I saw you, and we have Alan. When you get there, you'll have so little money to adjust because of the commitments that are already existing, unless you reform everything. Okay? But my children will not be able to afford this. And our people, our whole country cannot afford this. Let's have the next slide. Now, this is straight from the White House. I pulled it off the internet 2 days ago. Without health care reform, we're going to spend a little over $1 trillion on Medicare in 2016. And in 2019, that grows to about $1.26 trillion. With health care reform, we spend $1.12 trillion, and it grows to $1.18 trillion. And I'm sorry, with reform, we spend more. I flipped the numbers around. The annual growth of inflation with health care is 6.4% without reform, 5.6% with reform, but we spend more with reform because more people get covered. So those people who argue in Washington today and next month and next year that we can save money by reforming health care and will spend less are being deceitful with you. Only in Washington is a lowering of the inflationary cost of growth a reduction in spending. For any of us, if our costs go up from $1 trillion to $1.22 trillion, we're spending more money. Okay? So there is no easy solution to control healthcare costs by reforming healthcare. They cannot do it. This is coming. These numbers are straight from the CBO. This is available at the White House. This is in the U.S. President's Council on Economic Advisors report for this month on healthcare reform. Next slide. I'll finish with this. Well, political advocacy, what you're doing tonight, by the way, is the art of making the impossible possible. Remember, Charles Dickens once said that credit is a system whereby a person who cannot pay gets another person who cannot pay to guarantee that he can pay. That works, doesn't it? Well, let's see what another person has said. I personally say there are many parallels in politics. Okay? So right now we're all promising to reform health care, and we can't even pay for what we have. So I'm very fearful that the whole house of cards will come crumbling down because the Chinese don't want to loan us any more money. We don't have enough money. You can tax everybody and everything you earn, and it's only $14 trillion. And that economy will shrink immediately if we start taxing it 100%. So I'm very skeptical that we can do this through an expanded government system. And I'm very fearful for my children and for you and your children and grandchildren that they can afford this as well. So you're here tonight, but remember, there are people that we're talking about this who are not here tonight, who are much younger, and who are still yet to be born, who will shoulder this burden. And I think it's a responsibility we have as Americans to not saddle them with a debt that they cannot pay. Thank you very much.